Welcome from Wales.
Croeso o Gymru. Wales is part of the United Kingdom, and as a country we're just under 21 kilometres squared, about the size of the state of New Jersey, but with 5 million less people. Wales's population is only 3 million, and we have our own unique language.
The song you can hear in the background is Callan Lan, which is sung in Welsh by Eleri Jones, a Welsh nurse. The song is about a desire for a happy and pure heart above all world's riches. Wales is home to beautiful beaches,
Traethiau hardd,
and more than 600 castles.
Mwy na 600 o cestyll,
Home to mountains carved in the Ice Age,
hen mynyddoedd,
and spectacular waterfalls.
rhaidrau arbennig,
Home to mystical dragons.
dreigiau hudolus,
Home to Aneurin Bevan, founder of the United Kingdom's National Health Service. Aneurin Bevan was born in South Wales in 1897. His father was a miner, and the poor working-class family in which Aneurin Bevan grew up gave him first-hand experience of the problems of poverty and disease. When the National Health Service, the NHS, was established 70 years ago, it transformed health services for millions of people. Aneurin Bevan, like Florence Nightingale, was visionary, innovative and bold. They both were advocates of healthcare reform, dedicated to the provision of the highest quality of care for all that need it.
However, we no longer live in the world which the NHS was originally designed for. People are living longer, their health needs are more complex, lifestyles and expectations have changed. The need for change is with us now. Technology is transforming the way we live and the way we deliver healthcare. This is set out for us in Wales in the Healthier Wales strategic document for health and social care, where digital is at the heart of the vision. We as Welsh Florence Nightingale Digital Scholars can rediscover the confidence and bold ambition that made Wales the birthplace of the National Health Service.
Here now is Sian Thomas, a Welsh Florence Nightingale Digital Scholar. I met Sian 35 years ago when we started our nurse training in Cardiff, the capital of Wales. I am pleased to call Sian not only a colleague but a dear friend. Sian now works like myself at Aneurin Bevan University Health Board. She is the only consultant nurse in child health in Wales, and she was awarded the Royal College of Nursing's Welsh Nurse of the Year Award for her exceptional leadership. It gives me great pleasure to hand you over to Sian Thomas, who is here today to talk to you about her digital project.
Thanks, Anne. My name's Sian Thomas, and I'm a consultant nurse in child health at the Aneurin Bevan Health Board. I've been nursing over 30 years and a consultant nurse for over 10 years. I'm the only consultant nurse for child health in Wales. What the role entails is the strategic development of clinical practice, driving services forward, influencing paediatric nurse education, and undertaking clinical research in a specific area. The project I've been working on recently is for the development of care close to home service for children. What the aim of this service is enabling timely hospital discharge and the prevention of hospital admission for children who are acutely unwell. They're medically stable but require nursing intervention in the community. This is in line with the strategic direction locally within our health board and nationally. What the project has shown is there's a gap in relation to the flow of patient information between the hospital and the community. There's a key project in Wales that has developed a digital Welsh nursing care record, but this is for the adult services, and a different project for digitising the community nursing record. But the gap between the hospital and community is evident and is required to enable safe, accurate patient information. My project is focusing initially on the development of an e-referral from the hospital paediatric ward to the care close to home service to enable the safe transfer of patient information. This will ensure accurate information, patient flow, and prevention of duplication of clinical information.
It now gives me great pleasure to introduce a great colleague of mine, Professor Ewan Hale. Ewan is a consultant nurse in specialist child and adolescent mental health services. So it's over to you, Ewan.
Hello, everybody. My name's Ewan Hales. I'm a consultant nurse in child and adolescent mental health services at Aneurin Bevan University Health Board, and I'm a visiting professor at the University of South Wales. I'm here just to give you a bit of information about my project. I'm a Florence Nightingale 2020 Digital Scholar, and I'm sponsored by the Office of the Chief Nurse in Welsh Government. And my project is to develop specialist assessments for child and adolescent mental health services. We utilise in Wales a choice and partnership model, and choice is the initial assessment. We give them a choice in that, who they see, etc., where they're seen. And partnership basically is the ongoing therapy, which is specialist or specific partnership, which is often cognitive behaviour therapy, EMDR, other psychological therapies, and also working with a community psychiatric nurse. My project is focused on the choice assessment from a specialist perspective. So we're talking about young people who are coming in on an emergency presentation at our emergency department, who are self-harming, who have a profound eating disorder. So the idea is, instead of doing the initial choice assessment on them, which is more focused on young people coming in with moderate to severe mental health difficulties, we actually employ an assessment scale that's designed to focus on the difficulties they're coming in with. The project basically is going to be provided digitally when the assessment scale is developed, and that'll be rolled out across the whole of Wales. We're initially going to be setting up 3 focus groups. The first focus group will look at what scales are available out there at the moment and to fine-tune those. The second focus group will be able to approve and basically put the scale together for each of the identified specialist areas. We'll then pilot it for 6 months in 2 of the Welsh Health Boards, and then the third focus group will actually be to fine-tune it and sign it off. And after that, depending upon whether or not the digital notes have been rolled out across Wales, we'll initially be going to use the documentation paperwise. If it's digital, it'll be going straight into digital, and it'll be a drop-down section of the core choice assessment that the people are assessed with when they come into the services. We're pretty pleased about this because it gives us the ability to actually look at what sort of people are coming through the emergency pathway, what level of acuity we're dealing with, whether or not things have changed during COVID and post-COVID. Are we seeing more young people with certain difficulties, for example, eating disorders, psychosis? It also gives us the ability to see what young people are coming in all areas of Wales, really, so we can compare and contrast admissions and acuity across Wales. Thanks everybody for listening to my part of the presentation. It gives me great pleasure now to introduce Annette Beasley, who's the Macmillan Lead Cancer Nurse at Cardiff and Vale University Health Board. Annette's project title is Identifying and Meeting the Needs of People with Cancer through Implementation of the Macmillan Electronic Holistic Needs Assessment. Enjoy her presentation.
Hello, my name's Annette and I'm the Macmillan Lead Cancer Nurse in Cardiff and Vale University Health Board. I have a strategic nursing leadership role in my organisation and my portfolio is varied, but this includes providing professional leadership for the cancer specialist and generic nursing workforce, ensuring compliancy to cancer national guidelines and policies, and leading on the delivery of person-centred cancer services. Most of my clinical and managerial positions have been in the field of cancer. I'm interested in people and the impact which cancer and treatment can have on their physical, psychological and social functioning. I'm particularly interested in how we can support people to live the best life possible following a cancer diagnosis. So this is about looking at the patient as a person with holistic needs and concerns, rather than a patient with a cancer diagnosis. In my current role and as part of the Florence Nightingale Digital Leadership Scholarship, I am leading a quality improvement project to implement the Macmillan Electronic Holistic Needs Assessment throughout the Health Board. This electronic tool was developed by Macmillan Cancer Support and enables people with cancer to take control of their care by self-reporting their concerns prior to the consultation with their cancer nurse specialist. The purpose of collecting this information is to facilitate discussions with the patient regarding their physical, emotional, practical, financial and spiritual concerns. This then facilitates the co-production of a bespoke care plan for the individual based on their desired outcomes. The electronic holistic needs assessment can be completed at home on mobile phones and iPads. Once completed, the cancer nurse specialist can view the holistic needs assessment online. This means that the nurse is aware of the person's concerns and needs before the consultation. Therefore, the discussion in the consultation is driven by the person's concerns. During the consultation, the nurse and the person will co-produce a care plan, which is recorded on the electronic holistic needs assessment. A copy of this care plan can be emailed to the person, but it can also be uploaded to our NHS digital platform so that other clinicians involved in the person's care can view it. Aside from the individual patient benefits, a major benefit of the electronic holistic needs assessment is that it allows the collection of data describing the needs of patients with cancer across the Health Board. This assists us not only in reporting, but also in planning and the development of future cancer services. So our progress so far. I have been working tirelessly to ensure our Director of Digital and Health Intelligence is content with the general underpinning governance, the cybersecurity certification, and the cyber audit infrastructure of the electronic holistic needs assessment platform provider. We have an agreed data privacy impact assessment. Our cancer governance infrastructure, culminating in the Cancer Board, will provide a governance framework for the electronic holistic needs assessment quality improvement project. A standard operating procedure for the electronic holistic needs assessment has been developed and tested in a first pilot involving 3 site-specific cancer teams. This new way of working was fully evaluated with patients and healthcare professionals. Patients told us that the practical things highlighted on the tool was great. They could discuss the real things that matter to them. One person said it gave me permission to talk about things. And another said, I felt this was about me as a person. Everyone cared about me first, then my tumour. So our next steps, we are currently scoping the baseline, how many paper holistic needs assessments are being done in our Health Board, and I don't think there are many. December and January, we will be training all staff on how to use the Macmillan Electronic Holistic Needs Assessment tool, and February and March, we will be undertaking a larger pilot involving 6 site-specific cancer teams, all of which have volunteered to participate. This is really exciting, and I look forward to rolling out the electronic holistic needs assessment throughout all teams on my Health Board, hopefully by next summer. Thank you so much to everyone who is supporting me in this project. I'd like to introduce our next scholar, who is Anne Watkins. Anne is the lead digital midwife in Aneurin Bevan University Health Board, which is only 12 miles down the road from my health board in Cardiff. Although we are practically work neighbours, Anne is a new friend and colleague. We hadn't met before we were recently introduced through our Florence Nightingale Foundation Digital Leadership Scholarship. I'm really looking forward to getting to know Anne and sharing a glass of wine or two with her and the other Welsh scholars when we can. So here she is to tell us more about herself and her project. Thanks, Anne.
Thank you, Annette. Hi, I'm Anne Watkins, the Digital Lead Midwife for Aneurin Bevan University Health Board. I initially trained as a nurse and then later as a midwife, and I now have gained 29 years of midwifery experience. Who would have thought, in the 1980s, when I was the only girl sat in my computer science class at school, that digital transformation would be such an important role of my midwifery career today. In the UK, midwives are autonomous practitioners. We care for low-risk women throughout pregnancy, birth and the postnatal period. And we work in partnership with our obstetricians to care for our high-risk women. My role as digital lead midwife is in its infancy, and the role is evolving as the maternity digital strategy is developed. I am currently working to procure and implement a digital maternity health record. Our current system is a mixed economy of both paper and digital systems. Tasks are being duplicated, tripled and even quadrupled at times. The maternity system I will implement is a full end-to-end maternity system. It will allow real-time recording of all events, whether that event occurs in the hospital, the community or in the woman's home. A recent time and motion study identified that efficiencies of up to 900 days of midwifery time can be saved by implementing this new system, giving midwives time to care to spend with their women. The new system also has a portal for women to view and access their own maternity record online. My project, it aims to develop the personal guide for pregnancy, birth and beyond that women will be able to access via this application. Women are telling us that the information they access is online. Yet all the information we provide as a health board is in a paper format, and we know that everybody goes to Dr. Google for advice. But this isn't evidence-based information. The aim of this project is to use the application as a platform to communicate, educate and empower our women, so that all women have access to evidence-based information in the format that is best for them. However, the goal of the application is that the application would not only be used to give information, but to be used to educate as an education tool so that all women can access online complete birth and parenting programs. Women will have the opportunity to take more responsibility, not only for their own health and well-being, but also for their family. They would be empowered to make the best choices for themselves and their families. I'm pleased to say that I have both service user and multidisciplinary team engagement in the development of this application. It's just in its infancy, but I can see it growing and growing, and I'm excited to see where this project will develop. Thank you.
We feel privileged and excited to be the first Florence Nightingale Foundation Digital Leadership Scholars in Wales. Supported by the Senior Responsible Officer and National Lead for Digitisation of Nursing Documentation, we have had monthly webinars and one-to-one support. So far, we have had a real baptism into the digital world. We now have a greater understanding of informatics and technology and the NHS Wales Informatics Service. The digital lead for Welsh Government spoke with us about the Welsh Digital Governance and Strategy and gave an overview of national digital projects. we have met with nursing officers from Welsh Government. This enabled us to showcase our digital projects and gain from their wealth of expertise, knowledge and wisdom. In our individual health boards, we have linked with our strategic digital leaders and our executive nurse directors, ensuring our projects are on their agenda and joined with our health board's digital strategy and work streams. We are linked in with other Florence Nightingale Foundation digital leadership scholars from all over the UK, and regular virtual meetings and discussion groups enable shared learning, establishing and strengthening the community of digital leaders. To equip us with the skills and knowledge to develop our leadership abilities, we have undertaken leadership diagnostics, the results of which have enabled us to choose bespoke leadership programmes. Just a few weeks ago, we attended a CHIME Introduction to Digital Health Leadership. This was a fantastic day of learning from distinguished digital leaders, and we had a great reading list from Tim. What an action-packed start to our scholarship, and what an amazing opportunity. Our grateful thanks to everyone for supporting us on our digital journey. Thank you.
As Florence Nightingale Digital Scholars, we have to reflect on our journey so far and ask ourselves, what would Florence Nightingale say?
One of Florence Nightingale's quotes was, "Let us never consider ourselves finished nurses. We must be learning all our lives." This is true for all the digital scholars, and therefore I feel Florence Nightingale would be very proud of us all as we're carrying on her legacy. We're generating new knowledge, developing evidence-based approaches, and using that knowledge to improve patient care and health outcomes, just like Florence did.
Thinking about our scholarships and the fact that they are sponsored by the Florence Nightingale Foundation, a legacy project to an extent of the work that Florence Nightingale did in developing nursing and also developing evidence-based practice in nursing. We've given a lot of thought, really, what we think Florence would be saying about our digital projects and the whole idea of digitalisation in nursing. I think that she'd be really thrilled. From an evidence perspective, she'd be right up for it. From a development perspective, again, she'd be really, really keen. So I think she'd basically just tell us to go for it, you know, support us in what we're doing and develop nursing into and beyond the 21st century as a digital profession.
So what would Florence say? Florence Nightingale demonstrated that collecting and representing data can be a force to empower change. So I think Florence would say to me, Annette, be methodical in collecting data, tell the story with the data, and use the data to empower change, to ensure the services in your health board meet the needs of people living with cancer.
Florence Nightingale was a person who changed the mindset of healthcare professionals at her time. She would say, follow my lead and be the digital leaders to change the mindset of your colleagues and healthcare providers of your time.
I'd like to thank all our sponsors and their Florence Nightingale Foundation, obviously, but also the Office of the Chief Nurse in Wales, who's provided the funding for us, our health boards and our executive nurses, my fellow scholars and digital peers in Wales. And also we'd like to thank our services for putting up with us and helping us develop digitalisation and digital ways of working. And of course our family and friends for putting up with us, really, and letting us and giving us the time to try and develop these projects and try and develop nursing as a digital profession. Thanks again, and hope you've enjoyed what we've presented. Enjoy the rest of the conference. It's a brilliant opportunity and we're really, really proud to have been asked to come and talk to you. Diolch yn fawr iawn and see you soon. Thank you. Bye.